So I get messages from you guys all the time asking me if I were to do it all over again, would I still go to medical school or would I try something else out like PA school? Hi everyone, my name is Jenny. I'm a family medicine physician and a mom of two. And today I'm going to talk to you guys about some scenarios if I were to go to med school again or if I would go to PA school. So a little bit of backstory on myself. Stan and I started dating prior to med school. I got into med school, we continued dating, and then we got married third year in med school. I was pregnant with Wyatt in my fourth year of med school. Residency, we had London, our second child, and now I am currently an attending working part-time in an outpatient family medicine clinic. All right, so if you guys don't know the process, let's break it down real quick so we have a broad understanding. For medical school, you need 4 years undergraduate bachelor's degree in the United States, followed by 4 years of medical school, and then 3+ years of residency, depending on your subspecialty, before you can actually be a practicing physician working on your own. As compared to PA school, I believe that it is a bachelor's degree, also with over 1,000 hours of clinical hours, either shadowing, volunteering, working in the hospital, then followed by PA school, which is 1 didactical year and then 1 clinical year. After that, PAs are trained on the job in every sort of different subspecialties. So they are working under a physician and basically get their training, continued training that way. And we're going to be brutally honest today, and I'm going to tell you my experience and why I would make certain decisions. So if I were to go back and everything was the same, say I was in my 20s or in my 30s and I had no kids, I would 100% do it all over again. Doesn't matter of the crazy amount of school loans. I think of it as an investment on myself, on my dream job, on my passion. You know, like this is what I've wanted and it makes me so happy. So I don't put a value on that. And so it sucks paying back all these school loans, and I do think that it's unfair, but I feel very privileged and very lucky and honored to be in the position that I am. If I were to have kids, if I were to have to go back and London and Wyatt are like 2 and 4, honestly, I feel like I wouldn't. Like remember that this is all personal to me. Like I realized that I missed so much during my residency with Wyatt growing up that I don't want to miss that. And that's why I decided to pull back and work part-time so I can be there with London and appreciate all those little growing stages and milestones. In my mind, I feel like their time with me is fleeting and they're gonna be older soon. They're not going to think I'm cool anymore. They're not going to think that I'm their best friend. Someone else is going to fill that role. They're not going to want to snuggle me. So I just want to take the most advantage of this time that I have with them. And as I said, it is all a personal choice. I've had multiple people go to med school with young children and they are totally fine. It doesn't matter about the quantity of time, but rather the quality of time that you spend with your family that makes a difference. I've asked multiple friends who've had both physician, doctor parents, and they have always said that they always felt happy, they felt loved and appreciated and felt like their family was a unit. My dad was a computer engineer and he started up his own company when I was really young. And so apparently he was gone a lot, but I don't remember that. I remember the dinners that we had together and he was like laughing all the time or cracking jokes. I remember the parties that we would throw, the outings that we would go to, the Vegas trips, the snow trips. Like I would remember those times. Like I don't remember going to school and missing him at all, like to be honest, because we had that quality time that we spent together. So just because this is a decision I made selfishly for myself because I want to spend more time with him, even if I worked a little bit more, I don't think that Wyatt and London would be mentally or psychologically affected by those decisions. Do whatever is best for you and your family. So that being said, I would probably go back and go to PA school, but I personally would not go into family medicine because contrary to common belief, family medicine is really hard. And if you ask any specialist, they would tell you that in order to have a healthy patient, they have to have a good primary care doctor because that's your first line of defense. A good primary care doctor knows all the organ systems, understands what they can do and when they need to refer out. Like shoulder pain, yes, it could just be musculoskeletal, it could be osteoarthritis, but it could also be polymyalgia rheumatica, or it can be referred pain from the liver. There's so many different things, and as a primary doctor, to be good, you need to know all these things and you need to be able to figure it out. So I don't feel comfortable with the training in PA school to be able to do that because I was even worried as an intern in residency. Like I wasn't confident in my medicine, wasn't confident in my skills, and I just felt like I didn't learn enough and I needed someone to watch over me to give me that sense of security. If I were to go back to PA school, I would totally go into a subspecialty and have them train me either in orthopedic surgery or dermatology, just because it's easier for me to focus down on one particular topic and learn more about those topics. Or like plastics, maybe be just like an injection specialist. But you know, like in dermatology, I still get that continuity of care. There's only so many ways to treat a rash. Most of the time, it's just a topical steroid. And if I didn't know, there's a dermatologist right there that I can refer to. Over time, you're going to see things over and over again, and then you get good at it. There's still lots of different procedures like punch biopsies, shave biopsies, excisional biopsies, removing sebaceous cysts, like lots of procedures. And I feel that I would still be rather happy going that route. That being said, I really want everybody to dig down deep and forget what everybody else is saying, because at the end of the day, the decisions that you make, this is your career. You're the only one who's going to have to live it. You're the only one who's going to have to go to work. Why does it matter? I remember going back to college, like that was always the question, right? Like, are you really going to med school because your family wants you to go? Or is it because it's prestigious? Or is it because all your friends are on the same route right now? Or will people online think of you differently or poorly or say you're not good enough because you didn't get into med school? Like, who cares? Really, like, don't listen to any of that. Like, don't listen to them. I know it's really hard because society puts so much pressure on us to be a certain way, but it's not going to make you happy. And so this is for you. Like, sit down, dig down deep, really evaluate and look for those values. What do you want to have in a future career that you need to do as a physician? And is there any way to do that in another route? And I think that this is the answer only you can come up with. Because at the end of the day, for example, I'm a family medicine physician. And so there's a lot of people online who have said to me like, oh, you're not smart enough, family medicine is boring, you're gonna feel unfulfilled because you see the same things over and over again, and that I'm not successful and blah, blah, blah. Like, but I want to tell you guys that family medicine is legit. Like, it is one of the best specialties, and obviously I'm biased, but let me tell you why. So family medicine, you get continuity of care, you get to see everybody from babies, infants, all the way until they're old, and you become part of their family, and it's such a good feeling. Besides that, you get to do so many different procedures. On a random week, I can do a Nexplanon, IUD, lots of pap smears every single day. I can do endometrial biopsy, colposcopies, knee injections, shoulder injections, skin biopsy, shave, punch, excision, cyst removal, INDs. Like, there's toenail removal. There's so many different things and procedure wise that I do in my clinic. every single day. It's not like a random thing. And what's great about it is that you can tailor your practice to what you want it to be. I love procedures. I love doing them. And so I fill my patient panel with lots of procedures. And once other physicians know that, they start sending referrals to me. Like, I've been doing so many biopsies because, it's hard for people to get into dermatology. And they're like, oh, Dr. Lay does biopsies, so we'll just send you to her because it's faster. You'll get the results faster. If it's cancerous, we'll send you to dermatology at that time. If it's benign, then good. We'll just redo a skin check in a couple months. I am providing that need for my community as a family medicine physician, and it feels freaking awesome. I am also only working 2.5 days a week, and the rest of the time I get to spend with my family. I have a decent salary. I'm able to afford a home. I have 2 homes. I'm able to pay for my kids to go to school. We never have to worry about food. We haven't gone on a vacation at all because of the pandemic, but prior to this, we would go on at least 1 to 2 vacations a year. Like, my life is good, and I'm not trying to brag or anything, but for those people who say that you won't be happy unless you're like an orthopedic surgeon or a plastic surgeon or an OBGYN, like, yeah, I could have done those things to make other people happy, or because that's what they said that I should do. But I knew that I don't want to be on call. Like, I can't do the call schedule of an OBGYN or a surgeon. I don't want to be woken up in the middle of the night. I don't even want to take call from home. It's like, I just want to go to work. I just want to be there for my patients. I just want to build these relationships and do procedures. And that's exactly what I get to do. So if it's possible, I know it's hard, drown out the noise. Forget about what everybody is telling you what you should be and what you have to do, because at the end of the day, you don't have to do those things. What makes a good physician or provider is someone who works their best to provide the best patient care when patients have good outcomes, because you care about them. And it doesn't matter what you are. So decide what is best for yourself. Forget the labels. I can't emphasize that enough. And it really just takes some soul searching, some digging deep to understand that. And I know it's really hard, especially growing up in Asian cultures where my mom constantly told me every day that I was going to be a pediatrician. So I guess it boils down to length of education and training, cost of this training, and then a lot of people talk about autonomy. And so, yes, as a doctor, you make all of these decisions on your own, but you went through a lot of training, right? You went through residency, which is brutal, and constantly taking care of patients and constantly getting critiqued and learning. So 80 hours a week for 3+ years to become this doctor. So you were actually getting not as much autonomy in residency. So when you're a PA and you first come out and you have that overlooking physician, it's kind of like you're in residency. After 3 years, you're going to feel a lot more confident as a PA, and there's going to be a lot less oversight. Okay, a physician's going to probably look over your chart notes, but they're not going to come in to every patient and critique you and change your diagnosis or change your plan. That's not how it goes. So you actually have a lot of autonomy as a PA. If you go into a surgical subspecialty as a PA, you'll still get to see the patients. You'll still possibly do injections as an orthopedic surgeon, orthopedic surgery PA. And you still get to scrub into surgery, but you don't decide what surgery is being done, and you don't do the surgery. Your first assist, and you close, but you don't like determine what the treatment course is. Does that make sense? And if I were a PA in orthopedic surgery, I think I'd be fine with that. I'm like, all right, scrubbing into surgery, doing my favorite thing, which is closing the skin, and then we're good. I'll see you at follow-up. Oh, you need a hip injection? Let me get the ultrasound and do that for you. You need a knee injection? I got you. And so that's what I'm doing now as a family medicine physician. Like, you can do that too as a PA. All right, guys, I was talking really fast there. Let me know if you guys have any other questions in the comment section below. Love to hear your guys' experiences. I love that we learn and we share with each other. And so please comment down below. If you like this sort of video, if you guys want me to talk more about my part-time schedule as a family medicine physician and what that looks like, let me know in the comment section as well so I can make that video next week. All right. Thank you guys all so much for watching. If you haven't already, please subscribe and join the family. We put out new videos every week. Give this video a thumbs up, and I'll see you guys next time. Peace.